start the talk is to introduce to us Dorkas. Dorkas is the community and social engagement arm of our local church, the Redeemed Christian Church of God Impact Center, and we are in Bista. We are in Bista. However, the work of Dorkas is not limited to Bista. Our objective is to create awareness on mental well-being or mental health, just like we were talking about ignorance. We believe that there should be more talk about mental health and mental illness. There's need for us to create awareness and have discussions about mental well-being. So that is what Dorkas is all about. So that's mainly what we want to do. We want to create awareness. Sorry, I'm multitasking and I'm not good with that. So also we want to minimize mental illness, psychological breakdown in the community. So how do we do that? We create opportunity for people to have conversation with us, and we signpost them to push professionals like Dr. Sunita, like Toby, Ayodele Oluwatobi. So we fondly call him Toby. So these are clinical professionals that can help people when we have talk with them. We believe that by creating opportunity for people to talk with us, we could quickly, they could know where they are and signpost them to the relevant professional. So that is what Dorkas is all about. We want to minimize contact of mentally distressed people with the NHS. So this is our own quota, contributing our quota to our community. That's what Dorkas is all about. So tonight, once again, I want to welcome everyone that has joined us. My brother and friend, Pastor Dapodele, thank you so much for joining us tonight. And AO, I don't know who that is, but thank you so much for your time. We really appreciate your time. So before I introduce our speaker, once again, I want to thank every one of you for your time. I want to thank all our partners, all the partners of Dorkas, particularly every member of our local church, RCCG Impact Center, who are partners of Dorkas. We are also grateful to Cypress 203, especially their director, for his support. That is Mr. B. Oloko. I'm sure he's going to join us at some point. Also, we are grateful to my friend and brother. I'm sure, Doctor, you'll be thinking I have many brothers.
Yes.
That's the thing with us in the in African community. Everybody's our brother. And you know, the truth is, many of these guys, they are closer to me than my biological brothers. We've come a long way. Like my friend Dapo, we've come long. I think he's one of the guys that I've known since I know myself. So we are grateful to Toby. Toby is a registered mental health professional with extensive experience in forensic psychiatry and service consumer management in psychiatric intensive care unit. Thank you so much for your time tonight. He's going to be part of the panel when it is time for us to ask questions tonight. Before I introduce our speaker, I'd like to inform us that we know that mental health problems affect millions of us in our families, in our communities, and in the workplace, particularly with the pandemic. Everyone has mental health that will fluctuate in response to life events, like I said, like pandemic. So it will be unwise for us to suggest, like what we're doing tonight, that prevention is only for those who are currently enjoying good mental health. So when we're talking about preventing post-pandemic stress disorder that we are talking about tonight, we are talking with what public health says. They said prevention is in 3 stages. They said there is what is called primary prevention, there is secondary prevention, and there is tertiary prevention. By primary prevention, they mean that preventing problems before they emerge. So tonight we want to, we're hoping that we'll be able to prevent these PPSD in people before it escalates. And by secondary prevention, they mean that prevention for people exposed to inequality, particularly people exposed to risk factors, that is people who are less privileged, maybe people who are engaging in drugs or people who are lonely as a result of PPSD. You'll be surprised that a lot of people are suffering already as a result of pandemic because they don't have access to people. Thank God for our community whereby we connect with one another, we give each other calls, we support each other. But there are other people, even in the community, that does not have that privilege. So that is what we are hoping to deal with tonight. And once again, we are grateful to our speaker. Our speaker has 9 years of experience working with adults and families in clinical, NHS and private settings. Earlier on when we were chatting, she told us about a meeting that she needs to go into just immediately after this. So she has worked with individuals who have complex mental health needs and comorbidity. For example, personal disorder, or autistic spectrum disorder and PTSD. She is qualified to use a wide range of psychometric tests and clinical procedures in making assessment of intelligence and cognitive functioning, personality and trauma. She currently works as a highly specialist psychologist in an acute mental health settings for the Westmoreland NHS Trust. Actually, that's where we met, and I just like her. I believe that she's got something to add to the work we are doing. Our role is to provide rapid psychological assessment, formulation and brief intervention to adult service users experiencing a mental health crisis who require an admission to hospital. Additionally, she offers reflective practice, facilitate case formulation meetings to help the wider MDT. She develop and deliver care plans. She provide trainings, consultation, and supervision regarding psychological practice. She's also an expert witness providing medical, legal report for families, criminal and civil topics. She's a visiting lecturer at the Institute of Psychiatry, where she's involved in writing academic papers, and she loves writing. She disseminates her work by presenting at the BPS annual and pardon me, I'm trying to multitask here. Annual conferences on regular basis. She has also delivered training and teaching to training GPs. For example, common difficulties in discerning organic illness and healthy anxiety, increasing awareness of intervention and improving access. Now tonight, friends, I'd like you to join me as we welcome to increase our awareness in PPSD, Dr. Sunita Rajput. Doctor, over to you. Yes, we can clap. Let's see reactions.
Thank you so much,
Doctor.
Thank you so much for that comprehensive and very kind welcome, James. I'm speechless, but you've yeah. Should we start then?
Please. Yes.
Yeah. I was going to see if I can share my screen. So I want to start with what I aim to do is go through a PowerPoint, stimulate some discussion. So I don't want to spend too much time on this PowerPoint. I think it's so important that we as a group have some time to have a discussion and Q&A. So I'll start promptly. Yeah. Okay. Is that fine? Can you see the screen?
Yes.
Yeah. Okay. So post-COVID-19 stress disorder or post-pandemic stress disorder, I just want to start off by clarifying that it's not a official disorder in the